policy solution for Medicaid is block grant the program. So we figure out from a federal level, how much support are we going to provide? How much are taxpayers going to provide for health care? Medicaid also pays a lot of long-term care expenses. How much are we going to provide? Divide that in a sensible way among the states and give states that amount of money to say, here's your federal support to pay for healthcare services, long-term care services for the most vulnerable. I think that is the ideal reform for the Medicaid program. Block grants were not politically possible this year. So what are the solutions for the two main problems? The two main problems being the federal government's paying 7 times more for the able-bodied than the truly vulnerable, and the federal government permits all of this legalized money laundering.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, and welcome to the American Potential Podcast. I'm your host, David Fromm. Today, we've taken the podcast on the road to New Orleans and are recording from the State Policy Network annual meeting. What SPN works on is to strengthen state-based organizations that believe in limited government, free markets, and solving problems locally. We've had the chance to talk with some of these groups, and we're excited to share who they are and the solutions they're bringing to issues. For this episode, we're talking with someone who works on finding solutions to issues when it comes to healthcare. One of the biggest challenges on the horizon in healthcare is as Americans continue to age, how are states going to be able to afford those enrolled in Medicaid? Here's the problem. As baby boomers retire, more seniors are relying on Medicaid for these long-term care needs. And because states share the cost with the federal government, unlike Medicare, some budgets are under increasing strain. The question is, how will states manage the growing financial burden without sacrificing their other priorities? So let's talk about what states should be looking at doing with today's guest. I want to welcome back to the podcast, Brian Blase, who is the president of Paragon Health Institute. Brian, welcome.
David, thanks for having me.
Yeah, thanks for coming on again.
Yeah.
Looking forward to a conversation about, not very serious topic like healthcare, not complicated to anybody, doesn't impact anybody's life. I mean, it really is something that's pretty central that a lot of people, it impacts almost everyone. So, but tell me first about Paragon Health Institute and what do you guys do?
Yeah, so I founded Paragon about 5 years ago, and we try to improve government health policy to empower patients and to create the best set of incentives so that when people act on those incentives, we get good value, we get better health outcomes, and we minimize spending that doesn't do us any good. There's so many perverse incentives that result from government programs. And when we act on those incentives, we get lots of wasteful spending. There's a lot of fraud and abuse. And we try to minimize opportunities for really bad actors to take advantage of the American taxpayer, as well as what we can do to empower the patient so that the health sector orients itself around delivering for the patient, not for the government bureaucracy, not for the middlemen, not for the insurance companies, but actually serving the needs of the American patient.
So I think getting us back to serving the needs of American patients is one of the super key things here. But I'd love to hear about how you came to create Paragon. Like, what'd you do that made you a health expert?
So in graduate school, I've always been dedicated to free enterprise, limited government, and I wanted to get involved in public policy. I have actually before I got involved in public policy, I was a high school math teacher, and I knew that wasn't going to be my career long term. So I went to graduate school, studied economics, and my goal was to figure out an area where I could be a policy expert. And in grad school, I took a lot of really interesting courses in health economics and health policy, and just learned about all of these features of government programs that led to these adverse outcomes. And I am very much a fiscal conservative. Mm-hmm. And if you look at the federal budget, and you want to make it more sustainable, protect the interests of the American taxpayer, it's healthcare, it's Medicare, it's Medicaid. And I was fortunate to get an opportunity at the Heritage Foundation as a graduate fellow right before the Affordable Care Act or Obamacare passed. A couple months later, they needed a health policy analyst. They looked at me and I was doing good enough work for them, and they brought me on as a healthcare analyst. So I got to become an expert in key aspects of Obamacare. I then went to work for the House Oversight and Government Reform Committee. I led their work on healthcare entitlement programs. I went to the Senate Republican Policy Committee. I had done about 5 years on Capitol Hill. We'd just had our fourth child, so I was wanted less commute.
Yeah.
Got a position at the Mercatus Center, so I was leading their healthcare policy work. And then President Trump was elected in 2016, and I got asked to go serve in the White House at the National Economic Council. So in that role, I was coordinating health policy across the executive branch. I did that for about 2.5 years. It was the most meaningful, impactful work that I've done in my career. I then sort of went off and did my own thing, a lot of policy research, mostly through the Galen Institute. And then I got an opportunity in the summer of 2021 to start a new organization. And, it's a little overwhelming to think about starting a nonprofit, and I had no experience starting a nonprofit, but I was really able to put together a great team, and we launched Paragon in the fall of 2021, and we have just been killing it. And in part, there was just such a big opportunity for us because I think the free market side is probably outgunned by the left in health policy 100 to 1. And increasingly, the industry is aligned with the left. So they want more government regulation to protect themselves from competition, and they want more federal subsidies. So there was a real need among free market policymakers for actionable information. So at Paragon, we really pride ourselves on delivering what policymakers need to get real wins. So it's not just producing white papers for what the healthcare sector should look like in 10, 20 years. That work is important, and we do some of that. But it's really like, what can we do now that's consistent with our principles, that makes a better healthcare system for the American patient and the American taxpayer?
So I can tell you, as a member, someone who works for Americans with Prosperity, you've been a partner to our organization for probably since you started, a few years now, to our community Stand Together. And I can, as an outsider who is not, we've not worked together, but as an outsider, I can tell you that, the partnership has been enormously valuable to our states, our federal team. And I'm so glad that you're our partners. It's, I think you're doing a great thing here. And I think you're totally right. I mean, the left has the playbook on healthcare. They've done so much work. They've invested so much. They play a narrative that's unfair, but it works. And the right has been flat-footed for better part of a decade. And I think that we've started to really be able to put out there different reforms and ideas that are meaningful and starting to try to tell the story of how it can really impact people's lives, and how what the left is selling doesn't work. It actually limits your freedom and your what you can take advantage of. So I'm glad that you're out there fighting the fight. Let me ask you about, serving the Trump administration. I can imagine I can imagine getting up, going to the White House every day for work is a pretty cool thing to do. And I have friends who've done that, and I'm always envious. I think it's pretty darn cool. When I worked at Capitol Hill, I still loved the Capitol every day. I thought it was so cool. Yep. But now with the Trump administration been here for not quite a year, doing a lot of significant things. Are you optimistic about the future of healthcare at the federal level? I know we're going to talk to the state too, but about what's happening and where things are moving.
Yeah. So you're right. Going to work every day at 1600 Pennsylvania Avenue, that was the honor and privilege of a lifetime. And I've got to go back a few times with President Trump back in office. And I lost almost my entire policy team after the election, with many of them going into the administration. So the National Economic Council, the lead health policy staffer, came from Paragon. Domestic Policy Council, the lead healthcare staffer. There's only one healthcare staffer for each of these policy councils. They're both from Paragon. So we have, so I want like the Paragon, like long term, the best way for people like me, policy experts, to influence government is really to be on the inside. You want to be an advisor to, White House officials, the president, the Secretary of Health and Human Services. So with Paragon, what I think we have really done over the last 5 years is, while all out of power, developing the plans and the playbook for a set of policies that can be enacted when you have policymakers in charge of government who are sympathetic to what we want to do: expand choice, expand competition, and reform government programs. And what I want for Paragon is, when those people leave the administration, that they come back to Paragon rather than go to become a lobbyist. So much of the revolving door where, you work for a member of Congress, you then go and lobby, and it's corrupting. And the people that really believe in liberty and freedom, like, they should have other options other than going there. I am optimistic about the second Trump term. I think that, one, it's very well staffed. And I think it is, with Secretary Kennedy, the emphasis on that there are other things that matter for health rather than just expanding government programs. I think that's really important. There's so much that matters for health and well-being that is outside of this medical industrial complex. I mean, part of it is, what you eat, how much you're getting exercise. That's certainly a piece of it. But it's also our level of engagement with communities and the strength of families. And there's been so much deterioration in families and communities over time that has been detrimental to individual health and well-being. And I think it's important that we understand the health and well-being implications of a lot of the stuff that's gone on in society, the rise in social media and kids with social media. Like, there's a lot of stuff that's toxic about the modern culture that is very much outside the medical industrial complex, but that we need to have conversations about and understand.
I couldn't agree more. Look, we could nerd out on some things here. I am so excited about RFK Jr. running Health and Human Services, because I think we need a change agent. I love that this administration thinks about health more holistically. I think it's so important. I mean, I think, unfortunately, called the medical industrial complex, I completely agree with that. I think they've really tried to separate things and own there are certain portions to the detriment of the healthy American people often. I'm not saying they're all bad people there. It's just, the profit motive sometimes has obscured some maybe more holistic decision making that I think Secretary Kennedy and President Trump are trying to bring back. What's a healthy person look like? And I'm so excited for that move. I know they have stiff opposition to it. Anytime trying to change the status quo is hard, but I'm super excited about it. I'm glad that you share that. So let's talk a little bit about Medicaid.
Yeah.
Something way fun and exciting for everyone.
I wrote my dissertation on Medicaid, so believe me, I'm very excited about Medicaid.
Yeah, I'm sure you
horrified about Medicaid, I guess.
I'm sure you bust that out at parties every now and again, just for some fun reading. But so tell us, just going to the basics. How's Medicaid set up, and is it, in your opinion, really helping those that it's been created for?
Medicaid was created actually 60 years ago last month. The same legislation that created Medicare. It's a joint federal-state program. The key to understanding Medicaid is that the federal government provides an open-ended reimbursement of state spending. It was originally designed as a limited welfare program. So people that got cash welfare, Medicaid for them, people with low-income seniors, people with disabilities. One of the main issues with Medicaid is that it's been the primary vehicle that the left has used to expand government health coverage. So there's just been consistent expansions of Medicaid over the last few decades. And then the biggest expansion came with Obamacare.
Yeah.
Obamacare took off this sort of categorical eligibility where the focus was off of children and people with disabilities and seniors, and expanded the program to able-bodied working age adults. And it changed the federal-state financial relationship. So for traditional enrollees, the state reimbursement was a function of state per capita income. Wealthiest states got 50% reimbursement. Poorest states got 75% reimbursement. Obamacare created a 100% federal reimbursement for state spending on able-bodied working age adults. So it declined. It's now at 90%. One of the statistics that we really focused on during the debate over the One Big Beautiful Bill was that for every dollar that a state spends on an able-bodied working age adult, they get $9 from the federal government. For every dollar that they spend on Medicaid for a traditional enrollee, they get about $1.33 on average. So they get 7 times more federal funding for every dollar on an able-bodied adult.
Wow, talk about perverse incentives.
Yeah, and
Wow.
and that's exactly what we then need to see. So what happens? Well, states classify people as eligible under the expansion who aren't eligible, that might be eligible under a previous category, to get more federal funds. And then they develop all of these financing schemes because they're able to leverage $9 for every dollar that they get from the state. So the financing schemes, and this is what I wrote my dissertation on, open-ended reimbursement, but the federal government will reimburse fake state expenditures in addition to real ones. So what's a fake Medicaid expenditure? Here's the classic example of how it works. A hospital will come to the state and say, state, I want you to tax me $1 million. But then you're going to take that $1 million and you're going to spend it right back on me in the form of a higher Medicaid payment. So most people look at that and say, well, that's just an accounting gimmick. It's $1 million going from the hospital state back to the hospital. But the state then invoices the federal government for that $1 million. The average federal reimbursement's about 70%. So the federal government is giving the state $700,000 for an accounting gimmick. The state then takes a large part of that and sends it back to the providers that paid the tax. And it's corrosive. It undermines the fiscal integrity of the program when states can just make larger payments to healthcare providers without actually having state skin in the game. And we've seen these schemes explode over the past couple of years. The Obamacare match rate gives them a $9 rate of return on the money laundering. So $1 of money laundered funds can bring in $9 from the federal government.
So how's this affecting state budgets? Because on one hand, it seems like they could bring in more money, but on the other hand, it seems like all these extra people are actually really harming state budgets.
So I used to think of Medicaid as the Pac-Man of state budgets.
Yeah.
So if you look in terms of what states spend money on, they spend money on Medicaid, higher education, elementary and secondary education, transportation and infrastructure. And we were like, well, none of these others areas are categorized by an open-ended federal reimbursement. So Medicaid is crowding out other parts of the state budget. I no longer think that's the case. It's actually because states have gotten so good at these financing schemes and because of Obamacare, state spending on Medicaid as a percentage of like the state economy has been flat over the past 15 years. The entire fiscal cost of Medicaid's growth in like real terms has been borne by the federal government.
Oh, wow. So what are having all the able-bodied adults on Medicaid after Obamacare, how's that impacted states?
It gives states incentives to take resources away from traditional enrollees and spend them on expansion enrollees. So if the state gets 7 times more federal money for this population, they're going to figure out how to maximize that. So they create higher payment rates for providers that deliver services that are more likely to be received by able-bodied working age adults. So they're biasing the welfare program away from the intended recipient, the low-income children and people with disabilities, toward the able-bodied working age adults. So it's a complete perversion of what we would think of as a social safety net.
So how does that manifest itself in the state? Like practically, if they're choosing able-bodied adults over the poor folks, women, children, elderly, who it's designed for, how are those poor folks being further disadvantaged now?
So you see it in terms of access to providers. In states that expanded Medicaid, traditional Medicaid enrollees have had a 1/3 more difficult time obtaining medical appointments. So you see in expansion states, one of the main things that we've seen, and so not all states have expanded Medicaid. 40 states have adopted Medicaid expansion. So you can look at what are the trends between expansion states and non-expansion states. And one of the clear trends is a surge in the use of the emergency room for Medicaid recipients in states that expanded their Medicaid programs.
So what are there states that are doing, in your opinion, expert opinion, are there states that are doing a good job in how they interact with Medicaid, they use the money, that are being, responsible?
So it's a really good question. And I would say the 10 states that haven't expanded Medicaid, I give them a lot of credit. They've faced a lot of pressure from both the left and from the healthcare industry with the argument that, hey, this is free federal money. Why are you leaving federal money on the table? But they have protected their program for the most vulnerable. So I give those 10 states a lot of credit. In terms of the provider tax and the money laundering scams, the unfortunate reality is if you're a state and you are in a budget shortfall, right? You have three options. You can raise taxes, you can look at the budget and cut spending, or you could create another money laundering scheme and get the federal government to send money for the states and basically balance your budget on the backs of the federal taxpayer and just more debt, inflation, and higher interest rates. And what we've seen states do, and this is blue states and red states, is they don't want to raise taxes. They don't want to cut spending. And their concerns about the federal budget deficit are...
Yeah, they don't really care.
Yeah, I mean, they're state policymakers. So you see this situation where the entire cost of the Medicaid program over the last 15 years, in real terms, has been borne by the federal government.
Bless you.
Thank you.
So what do you see as potential solutions? What a better path forward with kind of this Medicaid mess?
So the long-time conservative policy solution for Medicaid is block grant the program. So we figure out from a federal level, how much support are we going to provide? How much are taxpayers going to provide for health care? Medicaid also pays a lot of long-term care expenses. How much are we going to provide? Divide that in a sensible way among the states and give states that amount of money to say, here's your federal support to pay for healthcare services, long-term care services for the most vulnerable. I think that is the ideal reform for the Medicaid program. Block grants were not politically possible this year. So what are the solutions for the two main problems? The two main problems being the federal government's paying 7 times more for the able-bodied than the truly vulnerable, and the federal government permits all of this legalized money laundering. For the expansion population, Paragon put out a paper last year that would have phased down the disparity until the state reimbursed the same percentage for all enrollees, and would have moved about half of the Medicaid enrollees into the Affordable Care Act exchanges with a generous subsidy. Unfortunately, that policy was introduced by members of Congress. got support, but it didn't get included in the One Big Beautiful Bill. The provisions that got included in the One Big Beautiful Bill that addressed the expansion population were community engagement requirements. So to be an able-bodied working age adult on the Medicaid expansion, you now, starting in 2027, you're going to have to work or volunteer 80 hours a month, which I think is a very reasonable requirement to place on a welfare program for an able-bodied working age adult. There's also going to be more frequent eligibility reviews. So we sort of advanced the conservative vision of, yes, it's a welfare program. The Obamacare dramatically expanded it. It pays too much for it, but people are going to have to work or engage in community service in order to be on it. With the money laundering, that's what I'm most excited about, what Congress did. So Paragon, we wrote a paper this year called Addressing Medicaid Money Laundering. We didn't coin the term Medicaid money laundering. I wish we had. It was coined by the Wall Street Journal in a 2008 editorial, but we made it great again. So, and I wasn't aware when we termed it money laundering that there was a Wall Street Journal 2008 article. But one of the things that Paragon did effectively is, one, we outlined the problem and we put forward policy solutions. We're also like, how can we communicate just how bad this is? Well, it's money laundering. It's legalized money laundering. And Congress took steps to reduce that provider tax scam. First time really in decades that Congress has reduced the provider tax scam, and to address another problem, which was these Medicaid payments were way in excess of what Medicare was paying. So basically, states were using Medicaid as corporate welfare to deliver excess profits to big hospital systems and paying rates that were much higher than what the Medicare program pays. We're like, no, the Medicaid program, it's a welfare program. It should not be paying providers more than the Medicare program. So Congress capped Medicaid payments at Medicare rates. So we got really positive action to limit Medicaid money laundering. And I think Paragon, we did a lot of work. We do sort of the model of what the process is. We produce research. We then have to communicate that research. So numerous meetings with members of Congress, congressional staff, educating, and explaining the problem. And we actually commissioned a poll. The first only ever poll that we ever did was on Medicaid reform. And the One Big Beautiful Bill reduces federal Medicaid spending over the next decade by $1 trillion.
Wow.
So it is the biggest entitlement reform that Congress has enacted in at least a generation.
Yeah, that's exciting. I mean, our biggest priority this year is supporting the president's efforts to pass the One Big Beautiful Bill. And it's just historic legislation that does so much. I know you kind of addressed this but maybe put a finer point on it for me. The left, this is their favorite talking point coming out about the One Big Beautiful Bill, is criticizing members of Congress for how it deals with Medicaid. Maybe what's your answer to those political attacks?
We're very clear. There are no Medicaid cuts. So if you look at the Medicaid changes during the Biden administration, Medicaid spending exploded. So from the start of the Biden administration to the end of the Biden administration, federal Medicaid spending is projected to be $1.3 trillion higher over the next decade because too many ineligible people were kept on the program, and because the Biden administration allowed too many of these Medicaid money laundering scams to expand. So what this bill does is really, largely, it undoes the excessive growth in the program during the Biden administration, and it does some structural reforms. I think both the work and community engagement requirements and the limits on states' ability to use these provider tax scams are meaningful reforms. Interesting, one of the things that we really did, and I put out a piece in February of this year saying what Republicans should do is build on Obama administration proposals. So the Obama administration proposed reducing the provider tax limit in the exact way that congressional Republicans did in the One Big Beautiful Bill.
Wow.
We dug out that, It's actually when I was writing my dissertation on Medicaid financing, I read Bob Woodward's book, The Price of Politics. It's a great book. It goes through, the last major effort of parties to come together to reduce the federal debt. But provider taxes came up, and Joe Biden called them a scam. Yeah, he called them a scam and said that they should be eliminated. And this is a cogent Joe Biden when he was vice president in 2011.
That is some time ago, though. Well, Brian, I wish we could talk about this all day, because this is, I know that you would love to talk about it all day, but this is really informative. I mean, I think a lot of people don't understand these programs, and then they hear about what happened to One Big Beautiful Bill. Unfortunately, I think the left is playing a lot of politics and trying to confuse people. And the reality is, it's like, we want to take care of those people who need care. Our society seem to make that decision. We just really need to figure out how we do it in a responsible way. So I just think that it's really important for us to get this right. So.
Yeah, I mean, we're a generous country. We're going to have a social safety net, but we should not have, we shouldn't have a hammock. And the second is we shouldn't allow so much cronyism and bad actors to take advantage of these government programs. Like hospitals should not be earning windfall profits off of the Medicaid program.
Agreed. Yeah. Well, thanks again for being with us. Appreciate it, Brian. So, hey, folks, if you like this episode and would like to stay connected with the podcast, be sure to like and subscribe to our channel. And you can find us on YouTube, Facebook, and Instagram. And always remember, freedom and liberty aren't free. They can easily be taken for granted. Don't take it for granted. Defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.